Are there any risks associated with eggs during pregnancy? Raw eggs or soft-boiled eggs carry Salmonella bacteria. During your pregnancy, you need to cook eggs properly until both the white and yolk turn solid. It, therefore, kills the bacteria and makes eggs a safe option to eat. Though Salmonella poisoning will not harm your baby, it can be unpleasant for you as it could cause abdominal pain, diarrhea and severe vomiting, high temperature, headache. In the UK, eggs are produced under the British Lion stamp, which reassures that eggs are free of Salmonella. These eggs are produced under hygienic conditions and are laid from hens which are vaccinated against Salmonella. These eggs are safe to eat during pregnancy. Also, a survey in 2006 stated that the eggs produced under the British Lion stamp carried no Salmonella. An egg's yolk contains 185 milligrams of cholesterol, according to the Incredible Egg Organization. In a day, an adult should consume fewer than 300 milligrams of cholesterol. Eating 2 eggs each day would put a pregnant woman over the recommended amount of cholesterol. This does not take into account any of the other cholesterol-containing foods she has eaten. Depending on the rest of a pregnant woman's diet, eating 1 or 2 eggs most days of the week may not be harmful. A woman who is overweight or struggling with high cholesterol during pregnancy could increase her risk of complications by eating eggs every day. The National Institutes of Health recommends limiting egg yolks to 3 or 4 per week. For a low cholesterol option, you can use egg whites. Consult with a healthcare professional about whether eating eggs each day would create unnecessary risks to your pregnancy. It is never advisable to consume raw or partially cooked eggs because of the risk of Salmonella infection. This includes all versions of raw or semi-raw eggs, homemade mayonnaise, eggnog and any similar foods. Salmonella infection can't be transferred to the baby during pregnancy, but the side effects can cause preterm labor, unnecessary uterine contractions that can stress the baby, or dehydration from persistent diarrhea or vomiting. Handling raw eggs can elevate the risk of infection and should be dealt with by thoroughly washing surfaces and hands that encounter the egg. Storing eggs safely will help to keep them free of the Salmonella bacteria. Keep eggs in the fridge. Don't let eggs come into contact with other foods. Keep them in a separate egg tray or in the box that they were bought in. If you eat soft-boiled or runny eggs, make sure that they're not past their best before date. Don't use eggs with damaged shells, as dirt or bacteria may have entered. Don't keep hard-boiled eggs in the fridge for more than 3 days. When cooking or preparing eggs, don't splash raw egg over other food, utensils or surfaces. Wash and dry your hands thoroughly after touching eggs or cooking with them. Bacteria can sometimes be found on the shell, as well as inside. Clean all utensils thoroughly with hot, soapy water. Wash kitchen surfaces using hot, soapy water or antibacterial spray and a clean, damp cloth. For eggs that are not stamped with a British Lion mark, err on the side of caution. Cook the eggs until the yolks and whites are solid. This will destroy any Salmonella bacteria, making them safe to eat.